Hello everyone, this is Katekani Ngobeni from the Council for Scientific and Industrial Research. We're going to be discussing personal protective equipment and actions around personal protective equipment to help stop the spread of COVID-19 in South Africa. Our healthcare systems are responding to this infectious disease threat on a daily basis, and those numbers are going to increase as the pandemic grows. The knowledge that is in existence is that it spreads from one person to the other via the respiratory droplet and coming into contact with an infected person or touching surfaces or through shaking hands. Signs and symptoms to look out for when you're at home are fever, cough, shortness of breath. But once you experience any of these other symptoms, you must seek medical attention, and those symptoms include difficulty breathing, a shortness of breath, persistent pain or pressure in the chest. So how does COVID-19 spread? There's currently no vaccine to prevent the coronavirus disease. Best way to prevent illness is to avoid being exposed to the virus. And the virus is thought to spread mainly between people who are in close contact with one another through respiratory droplets produced when an infected person coughs or sneezes, and when these droplets can land in the mouth or nose of people who are nearby or possibly inhaled into the lungs. Actions and strategies to stop the spread of airborne infections are categorized in 5 different levels, but for the sake of this exercise, we can look at elimination. Elimination in this case, because there's currently no vaccines available against COVID, so there is no possible way to eliminate it. Can we substitute COVID? Currently, no, we can't. And then we can move on to other engineering controls that you can put in healthcare facilities, such as systems that can help prevent the spread within healthcare facilities. This can also be applied at home by opening windows or by isolating the infected person. Administrative controls would possibly be, how do you manage on a day-to-day basis? What are the different policies that you have in your facility that is in a healthcare setting? What are the existing control measures in your department if you will be currently working throughout this pandemic? And lastly, we have personal protective equipment. This is not used as a last resort, but should be used in combination with engineering controls and administrative controls, and it should not be used in isolation. This should be used by people that want to protect themselves from contracting COVID, and by people that are protecting other people from being infected. Those are the people that are currently infected with COVID. So what is personal protective equipment? PPE is a precautionary step to protect yourself and the people around you. PPE is categorized or specialized clothing or equipment worn for protection against dangerous or infectious material, and it prevents contact with infectious agent by creating a barrier between the potentially infectious material and the public health practitioner. So there are different levels and the different categories of personal protective equipment, but in order for you to know which ones you need to don or use, you need to know the mode of transmission of whatever it is that you're protecting yourself from. As an example, if you know that TB can be spread via the airborne route, you know that you need to protect your respiratory area and you need respiratory protection. If you know that COVID is spread via the contact route, as an example, you need to create a barrier that will prevent contact, direct contact with the infectious agent. That can be through the hand, through body protection, through foot, through eye and face protection. Honorable President Mr. Cyril Ramaphosa, the presidency, together with the National COVID Council, developed regulations and guidelines that we as a nation are required to abide by. It is essential that every person adheres strictly and without exception to these regulations that have already been put in place. The presidency and the National Coronavirus Commandment Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, 26 March. The categories of people who will be exempted from this lockdown are the following: healthcare workers in the public and private sectors, those in security services such as police, traffic officers, military medical personnel, soldiers, and other persons necessary for our response to the pandemic. With essential personnel that were required or deployed by the government to continue serving the country in these trying times, they need to strictly adhere to good use of personal protective equipment. And employers must ensure that these individuals are trained on how to correctly use these personal protective equipment. The first category here is medical personnel. They can use head, eye and face protection, respiratory protection, hand and body protection, and foot protection. And for those people that do not fall under this category, which includes people in the community and people who are considered not essential for this pandemic, should strictly stay at home unless they're leaving their home to get medical attention or to get basic food supplies. When we look at the different types of eye and face protection that can be used for this purpose of COVID, number one are goggles. Goggles should form a good seal around the skin or face. They should be flexible PVC, which fits easily around the face. It should enclose the eyes and the surrounding areas, and it should accommodate wearers who wear prescription glasses. There should be clear plastic lens, which is fog and scratch resistant, and there should be an adjustable band to secure firmly so as not to become loose during clinical activities. People who are considering using a face shield should make sure that the shield is made up of clear plastic and provides good visibility to both the wearer and the patient. There should be an adjustable band to attach firmly around the head and fit snugly against the forehead. It should be fog resistant and it may be reusable if possible, otherwise it should be made of robust material which can be cleaned and disinfected. If using hand protection, the specifications are as follows. For people that are going to be examining patients, the outer gloves should have long cuffs reaching well above the wrist, ideally to the mid-forearm. If personnel should be involved in surgical activities, the gloves should have long cuffs reaching well above the wrist, ideally to mid-forearm. For body protection such as aprons, the aprons should be straight with 100% polyester with PVC coating or 100% PVC or other fluid-resistant coating material. Another example of body protection are scrubs, which will be used by healthcare workers. Can include tunics, and the tunics should be woven, reusable or single use, and they should form short sleeves or worn underneath the overalls or gowns. In addition to that, healthcare workers or other individuals that could be caring for people that are infected with COVID should wear gowns and overalls over their scrubs. And these gowns and overalls can either be single-use disposable, length should be mid-calf, or they can be reusable overalls which should be properly disinfected after use. Respiratory protection can be categorized into two main groups. First one is air purifying respirators. The other group is atmospheric supply respirators. Air purifying respirators are defined as having filters, cartridges or canisters to remove contaminants from the air that the respirator user breathes. Another category, which is the atmosphere supply respirators, provide the respirator with clean air from an uncontaminated source. Now, the ones that we're going to be using for protection are air purifying respirators such as N95 or FFP2s or half-piece or full-face piece masks which use cartridges to disinfect the air. This is a visual demonstration of the different types of negative pressure and powered air purifying respirators that can be used for protection. So there are two different commonly used types of respirators, N95 or a surgical mask. But this can further be categorized into three different categories. Number one being an N95 respirator, which should be NIOSH certified. And number two is a surgical N95 respirator, which should also be NIOSH certified, but also be FDA cleared. The third category is surgical mask, which should be FDA cleared, which is the Food and Drug Administration. Now, what is the difference between these categories of respirators and surgical mask? The N95 respirator can be used for respiratory protection when a wearer might be exposed to particulate hazards. The second type is a surgical N95 respirator, which is meant to help reduce particles both inhaled and expelled by the wearer. And this is the one which would ideally be used for healthcare workers or people that are caring for patients who might have COVID. The last category is surgical masks, which help reduce the particles expelled by the wearer into the environment. And this is the one that is recommended to be used by patients who might have COVID. So what is the legal framework that exists in South Africa with regards to respiratory protection? When we refer to N95 respirator, we mean that it is tested and certified according to CDC NIOSH standard. When the filter was challenged with particles as small as 0.3 microns, this respirator has a filter efficiency of 95%, and the N part stands for not resistant to oil, which means that if this respirator comes into contact with oil, water, this might compromise the performance of the respirator, and as a result, the filter will not be able to continue performing as it should. Now, there are different levels of filter efficiencies. They start from N95, but they can go up to N100. There are different other levels of resistance. The R means that it is partially resistant to oil, and then the P part means it is oil proof. So there's also different categories of filter efficiency with those types of respirators. So there are different other groups of respirators called the FFP range. FFP stands for filtering phase piece. Now, these types of respirators are classed or categorized into three groups. When the filter was challenged under lab settings in similar conditions but not exactly the same conditions as an N95 ranges, they found that an FFP1 was able to filter at least 80% of those airborne particles, and an FFP2 was able to filter at least 94% of those airborne particles. Now, if you want an equivalent of an N95 to protect yourself from particles, hazardous particles such as bacteria and viruses such as COVID, you would need an FFP2 range and above. Do we have standards in South Africa that talks to these type of respirators? The answer is yes. The SABS has a standard called the SANS 1866, which talks directly to the specifications for medical respirators and surgical masks. Part 1 of that standard speaks to surgical masks, and Part 2 of the SANS standard talks about medical respirators. So how do we then go ahead to check if an N95 respirator is indeed authentic? It should have a NIOSH logo printed on it. But further than that, it should have a TC approval number. What you can do is you can check the manufacturer's name on the CDC NIOSH list of respirators that have been approved, and check that TC number to see if it corresponds with the manufacturer's name. Now, if you're using this type of dark bill respirator, the same specifications apply. It should have a NIOSH logo printed on it. It should have a TC number. It should also indicate the filter performance of that respirator. You must always remember that you should not be using a respirator or PPE in isolation. It should be used in combination with other levels of control measures, including engineering controls and administrative controls. Healthcare facilities should develop clearly written procedures to advise staff to take care of the following steps to reduce contact transmission. They must discard N95 respirator during use of aerosol generating procedure. You must discard your N95 respirator which is contaminated with blood, respiratory or nasal secretions or any other bodily fluids from patients. You must discard your N95 respirator following close contact with any patient co-infected with an infectious disease during contact precautions. We are facing a global crisis with a global shortage of N95 respirators. We have to come up with innovative measures to optimize the supply of N95 respirators to ensure that our first line responders are adequately protected and there's enough supply to sustain them throughout this pandemic. So there's been recommended guidance for extended use and limited use of N95 filtering face piece during shortages. It has been defined by WHO and CDC as it being the practice of wearing the same N95 respirator for repeated close contact encounters with several patients without removing the respirator in between patient encounters. Extended use may be implemented when multiple patients are infected with the same respiratory pathogen and patients are placed together in the same dedicated waiting room or hospital wards. Another contingency consideration could possibly be reuse. Reuse is defined as the practice of using the same N95 respirator for one healthcare worker for multiple encounters with different patients by removing it after each encounter. This should not be considered for people that are coming into direct contact with COVID patients, but can possibly be considered with people that are not managing patients with COVID. This could include people in the food industry, in the banking sector, etc. You must make sure that you're adequately trained on how to use all these different levels of PPE before you reuse them. With respiratory fit testing, it is very essential to know that one respirator does not fit every individual. They come in different shapes and sizes. So it's very important to know what is the correct type of respirator for your specific facial features. And in order to determine that, every personnel that is expected to wear a respirator, the employer must ensure that they undergo fit testing. Fit testing is a method and procedure that determines and investigates what is the correct type and size of respirator an employee should wear for the specific facial features in order to ensure that the respirator that is given to them gives them adequate protection. A respirator should have a tight seal against the face of the person that is wearing the respirator. So if you have facial hair that might possibly compromise the seal of the respirator, you are potentially not adequately protected. So it's very important to ensure that the facial hair should be shaved in such a way that it does not compromise the seal of the respirator that you are wearing. 3 key factors that should be considered for proper respiratory use. The respirator must be put on correctly when worn during an exposure. The respirator must fit snugly against the wearer's face. So if you have facial scars or facial hair that might potentially compromise the seal of the respirator, you must consider that that might reduce the amount of protection that you are receiving from the respirator. Some of the steps that you can take to protect yourself. Wash often with soap and water for at least 20 seconds, especially after you have been in public places or are blowing your nose, coughing or sneezing. If soap and water are not readily available, you must use a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose and mouth with unwashed hands. Try by all means to avoid close contact. If you don't fall under the category of essential workers that should be working during the lockdown time, you must always stay at home. Avoid close contact with people who are sick and put distance between yourself and other people if COVID-19 is spreading in your community. This is especially important for people who are at high risk of getting very sick, such as the elderly. Always ensure that you cover your coughs and sneezes. Cover your mouth and your nose with tissues when you cough or sneeze, or use the inside of your elbow. Throw used tissues in the bin. Immediately wash your hands with soap and water for at least 20 seconds. If you are sick, you should wear a surgical mask when you are around other people. If you are at home, if you are being transported to another area and you're sharing the vehicle or you're sharing your space with any other people. If you're not able to wear your surgical mask, for example, because it causes trouble breathing, then you should do your best to cover your coughs and sneezes. Avoid being around people that you might potentially expose your infections to. Clean and disinfect frequently touched surfaces on a daily basis. This includes tables, doorknobs, light switches, countertops, handles, desks, phones, keyboards, toilets, faucets, and sinks. If surfaces are dirty, clean them. Use a detergent or soap and water prior to disinfection. This following video demonstrates fully on what are the steps and procedures on how to correctly wash your hands. Thank you for watching this video. For any further questions or inquiries, kindly email us on kngobeni@csir.co.za or visit our CSIR website for more information.